think it's very important. I think it's very important from a patient safety point of view, from a clinical governance point of view, and from population health. There are fewer financial imperatives about it. It's more about clinical safety and excellence of care, which is absolutely essential to our organisation. Well, there are so many aspects to this, but good coordination of chronic care is absolutely essential. It's essential now, but it's becoming more and more important as we progress in time with the growing burden of chronic disease. And really having proper interactive care planning where different stakeholders involved in a patient's care can communicate to each other in real time is becoming increasingly important. So having the accuracy of the information, the contemporaneousness of the information that allows good patient care, and essentially allowing the patient to have access to that as well. It's a difficult one because we're dealing with such a history of siloed care in our system, and it's a consequence of so many different things, not least the funding for healthcare in Australia. I think it's going to be a question of gradually breaking down those barriers. If you look at something like the healthcare home model, I think one of the only ways that that's really going to work is if you get a degree of case conferencing for patients. Now, case conferencing doesn't need to be on the telephone in real time. It can happen in a virtual manner. But I think that probably needs to happen to get good collaboration in care. So I think it's a really difficult one. I think there is a role for the ADHA to take on that leadership in that field, because it's about patient safety. There are so many documented cases of medical malpractice that have resulted from that failure in communication. And as far as the administrators of hospitals are concerned, I think you need to point out that actually if you pass on that information in a timely manner to GPs, it often prevents readmission. So there is actually a really important dollar saving to be made here as well as patient safety. Carrots usually work better than sticks. From a cultural perspective, inevitably you have various different initiatives that combine the two incentives, if you like, but I'm always in favour of carrots rather than sticks.